Welcome to the training on agents for mental health decisions, best practices in supporting mental health advance directives. This training is appropriate for a wide variety of audiences, including people interested in having a mental health advance directive, agents, tribal partners, certified peer specialists and peer supporters, people with lived experience, and family members of people who have mental health concerns. In this training, we will explain what a mental health advance directive is, the main parts of a mental health advance directive, and why they matter. We will explain how to choose the right person to be a mental health agent and what qualifies somebody to be a good fit for the role. We will describe what a mental health agent needs to know and to do to help support somebody during a crisis. We will describe how mental health agents can support somebody during a crisis by working with providers, responding quickly, and helping make sure that the MHAD is followed. Please note that this training is going to focus on the role of the agent. For information regarding the role of the mental health advance directive facilitator, a person who helps someone understand, talk about, and complete their MHAD, and other MHAD trainings, please click the link below. So let's start with an overview of what mental health advance directives are. This training is about a very helpful tool in mental health care called a Mental Health Advance Directive, or MHAD for short. An MHAD is a legal document that lets people plan ahead for their mental health treatment. It's used when someone may not be able to speak up for themselves or make decisions during a mental health crisis. Mental health conditions can sometimes cause confusion, fear, or stress that make it really hard for a person to think clearly or explain what they need. That's where MHADs come in. They allow a person to write down important information ahead of a potential crisis, like what treatments or medications help them, what treatments or medications they want to avoid, who they trust to make decisions on their behalf if they're unable to. The information in the MHAD can also help a person feel safer and calmer before a full crisis occurs. An MHAD does not just help the person who wrote it. It also helps the people who are trying to support them. Doctors, nurses, therapists, and crisis workers don't always know a person's history or what works best for them. An MHAD gives clear guidance to the care team so that they can make better decisions and respond in the most helpful way, especially during mental health crises or when providing help before a crisis occurs. It's important to know that an MHAD is a legal document. That means it has power. It must be taken seriously and included in a person's medical records. Care teams are expected to follow the directions in an MHAD unless there's a very specific reason why they cannot. Having an MHAD helps people stay in control of their mental health care, even during the hardest times, because it makes sure that others know how to provide support that feels right. You might be wondering who should have an MHAD. MHADs can be a powerful tool for individuals facing mental health challenges. This might include conditions like depression, bipolar disorder, schizophrenia, or anxiety, any situation where someone's mental health may fluctuate over time. They are also incredibly valuable for people who struggle with substance use, whether it's drugs, alcohol, or both. These challenges can sometimes lead to unpredictable or high-risk situations, especially during periods of crisis. It's also important that we don't overlook the impact of trauma. People with a history of trauma, whether from abuse, violence, loss, or other deeply distressing experiences, may be more vulnerable when under stress. Trauma can help shape how a person responds to crisis, and MHADs help ensure that their care reflects that understanding. While these are some of the most common groups who benefit from an MHAD, they're not the only ones. There are many other conditions and life circumstances that can increase the likelihood of a mental health crisis, and that's exactly where MHADs come in. They provide a structured, compassionate way for individuals to express their preferences, outline their needs, and ensure their voice is heard. So when asked, who are MHADs for? The answer is anyone who wants to be prepared, protected, and empowered in the face of mental health challenges. An MHAD is a legal document that lets someone plan ahead for their mental health care, especially in case there's a crisis in the future when it might be harder to make a decision or speak up for themselves. To fill one out, a person making the MHAD needs to have something called capacity. So, what does having capacity actually mean? Having capacity means the person is able to think clearly and make decisions about their own care at the time they're making the MHAD. To have capacity, a person has to be able to do three things. One, take in facts about treatments. For example, if a doctor explains two different kinds of therapy or medication, the person can understand what each one is. Two, compare the risks and benefits of those treatments. This means they can think through what might help, what might have side effects, and what feels right for them. Three, they need to be able to say what they want. This could mean choosing one treatment over another, or saying they don't want a specific type of care based on their past experiences. It's important to know that adults are usually presumed to have capacity, so there's no need to prove capacity before making an MHAD. So let's say someone named Jordan is thinking about creating an MHAD. Jordan has a mental health crisis as a young adult that resulted in his involuntary psychiatric hospitalization. He was diagnosed as having schizophrenia and began treatment with medications that have helped him. When he returned home from the hospital, Jordan completed an MHAD with the help of a local peer specialist. Under Washington law, it is presumed that Jordan has the capacity to complete his MHAD, and his MHAD is presumed to be valid. His diagnosis and hospitalization do not change that. If he has another crisis, providers must honor his MHAD. It's also important to know that Washington State allows youth ages 13 and older to make their own MHAD if they demonstrate that they are able to make an informed decision about behavioral health care. That's because in Washington, teens have a right to make some of their own choices about mental health care. So if a 13-year-old knows what helps them during a mental health crisis, they can complete an MHAD to make sure those preferences are honored. Now let's break down what's actually inside an MHAD and why each part matters. An MHAD usually has at minimum two important sections that work together to help someone stay in control of their mental health care. Let's start with the first part, advanced instructions. This section is all about writing down the person's preferences, the things they know from experience that help them, and the things they want to avoid. This might include medications that they consent to or ones they refuse, often because of bad side effects, types of treatments that are helpful, types of treatments they know do not work or make things worse, life responsibilities that are important, like making sure someone checks on their kids, pets, or home, who should help with bills while they're in the hospital. It's important to know that healthcare providers are not required to address these issues directly, as these are usually important responsibilities for the agent. These instructions are personal and powerful. They help doctors, nurses, and crisis teams understand that the person as a whole and to give care in a way that works for the individual. The second part of the MHAD is called the healthcare power of attorney. This is where the person can name someone they trust to make decisions on their behalf if they are not able to do it themselves. That person is called the agent. Now, here's something really important. Choosing an agent is completely optional. A person can still fill out an MHAD with just their advance instruction, and that document will still be valid and helpful. But having an agent can make things go more smoothly, especially in fast-moving situations where decisions need to be made quickly. Together, these two pieces make sure that a person's voice is still heard, even if they can't speak up for themselves, and that can make a big difference in how safe, supported, and respected they feel during a mental health crisis. It's important to note that having both of these parts is not required. A person may choose to just establish an agent or decide to establish only advanced instructions and not have an agent, and either choice is okay. When someone creates an MHAD, they're building a personalized guide for how they want to be treated during times when they may not be able to speak for themselves. MHADs can include a wide range of care instructions, each one helping to shape a more responsive treatment plan. For example, a person may describe their mental health condition in their own words, noting that what treatments have worked well for them in the past. Someone might write, "When I start feeling overwhelmed, I respond best to quiet environments and low lighting." These kinds of insights help providers tailor care to what's actually effective. MHADs also allow individuals to express clear preferences about medications. They can give consent for specific treatments like, "I authorize the use of Risperdal if I start experiencing hallucinations." Or they can refuse others. "I formally object to the use of Haldol. It causes severe side effects for me." Support systems are another essential part of the MHAD. A person might identify someone to contact in a crisis. They may say, "Call my friend Keisha, she knows how to help me calm down." Or they might name a trusted medical provider that they want involved in decisions. This ensures continuity of care and builds trust. Note that the proper release of information forms must be complete and present for care providers to be able to make these outreaches. For those in tribal communities, MHADs can include culturally grounded healthcare preferences. This might mean involving tribal health providers or community leaders, or requesting traditional practices as part of their support. These components, personal history, treatment preferences, support contacts, cultural preferences, are the core of an MHAD. They turn a legal document into a living expression of someone's voice, values, and vision for their care. When discussing MHADs, it's critical to recognize the unique considerations for American Indian and Alaska Native communities, especially here in Washington State, which is home to one of the largest American Indian and Alaskan Native communities in the country. Mental health advance directives are designed to center the individual's voice in their mental health care. But for tribal members, that voice is often deeply rooted in community, culture, and tribal sovereignty. So when creating and using an MHAD, work to prioritize cultural responsiveness as a foundational principle. Let's break it down into several key areas. First is tribal sovereignty. Tribal nations are sovereign governments with their own laws, healthcare systems, and protocols. That means that MHADs must be developed and implemented in ways that respect tribal authority. For example, if a tribal member receives care on tribal lands or through a tribal health clinic, their case should be approached in relation to that jurisdiction. Coordination between state systems and tribal entities is essential to ensure that these directives are valid, actionable, and culturally appropriate. Next, a person can use the MHAD form to identify if they are affiliated with a tribe and/or receive care through tribal healthcare providers, also known as Indian healthcare providers. This information can help connect individuals with their tribal community and healthcare providers supporting their care. Connection to tribal cultural teachers or community providers is also important. Mental health care is not just clinical, it's also relational. Many tribal individuals rely on extended family, elders, spiritual leaders, and community members for support. MHADs should reflect these preferences by naming who the person wants involved in their care. This might include a tribal behavioral health provider or a cultural practitioner. Including these voices ensures that care is grounded in relationships that foster healing. Identification of traditional, cultural, or spiritual practices is important as well. Western mental health models often focus on diagnoses and medication, but in many tribal communities, healing is holistic. It may involve ceremony, connection to the land, storytelling, or traditional medicine. MHAD should allow individuals to include these practices as part of their treatment plan. For example, someone might request access to a tribal healer during a crisis. Incorporating tribal-specific consideration into MHADs can honor the sovereignty, dignity, and cultural identity of tribal individuals. This helps move from a one-size-fits-all approach to one that truly meets people where they are. Let's talk through a few legal considerations. One really important question is, when does a mental health advance directive become active so it can help guide a person's care? When someone fills out an MHAD, they get to choose when it becomes active. That means they decide the point at which the MHAD starts guiding their care, and if they've picked an agent, when the agent can begin helping with decisions. There are three main options for when an MHAD can go into effect. The first option is when the MHAD is signed. In this option, the MHAD goes into effect right away, as soon as it is signed by the person and either a notary public or two adult witnesses. This does not mean the person is giving up control. They still have capacity and they still are in charge of their care. They can make their own decisions just like before. But if they've chosen an agent, this option allows that agent to be involved right away. The agent can talk with the person's mental health or medical providers, review records like treatment history or medications, help the person think through choices and give support. This might be a good option for someone who wants help navigating care now, not just during a crisis. They might not be in crisis, but they want their agent to have access to support them in planning, attending appointments, or staying on track. This can be helpful. if the agent is actively informed of the person's care and has up-to-date detailed information if a crisis occurs. As an example, the person might say, I want my mom to be able to talk with my therapist right now and help me plan my care, even though I'm doing okay in the moment. Even if a person does not need help now, this option can also help reduce barriers for the agent's authority when a person is in crisis, since it doesn't rely on a healthcare provider to determine if the person is incapacitated. The second option is when the person is found to be incapacitated. In this option, the MHAD goes into effect only if and when a healthcare provider says the person no longer has capacity. This means a doctor or mental health professional would need to evaluate the person and determine that for now, they are not able to make informed decisions about their care. At that point, two things happen. The instructions in the MHAD must be followed by the care team. If there is an agent named, their legal authority begins. They can now make decisions, speak for the person, and help make sure the person gets the care they wanted in the MHAD. Before that moment, while the person still has capacity, the agent cannot step in. They don't have the power to act or make decisions until the provider makes that formal determination. As an example, a person might indicate, if I'm in psychiatric crisis and have been deemed incapacitated, I want my MHAD to activate and my agent to take over only then. This option gives some people comfort because they can keep full control of their care until they truly cannot speak for themselves. In option 3, the MHAD becomes activated when certain events or conditions happen. The third option gives people even more flexibility. They can say, my MHAD should go into effect when certain things start happening, and then describe what those things are. These are trigger events that can be anything the person knows that are signs that they are heading into a crisis or starting to struggle. For example, they might say, when I stop sleeping for more than 2 nights in a row, if I stop taking my medication and start isolating from everyone, if I become verbally aggressive towards family. But this option requires something else too. The person must say who gets to decide when those signs are happening. This could be a family member, a friend, a therapist, or somebody else they trust. As an example, they might say, if my sister sees that I've been hearing voices and not taking my meds, I want her to let my provider know that it's time for my MHAD to be used. This option works well for people who may not want to wait until they are formally declared incapacitated, but who want to catch the crisis earlier before things get too overwhelming. So, which option is best? The answer is that there is no right or wrong answer. It's all about what feels right for the person and what helps them feel most supported and safe. Some people want their MHAD to be active right away so their agent can be involved in a support person from day one. Others want to wait until they truly lose the ability to speak for themselves. And some people know the early warning signs of a crisis and want their MHAD to activate when those signs start to show up. No matter which option they pick, the most important thing is that the person has a plan that reflects their wishes and that providers and supporters follow it. Under current legislation, providers are required to honor MHADs to the fullest extent possible. That phrase, fullest extent possible, is key. It means that in general, a person's documented preferences for their mental health treatment must be respected and implemented. However, there are specific exceptions built into the law. These exceptions are safeguards. They exist to ensure that care remains ethical, legal, and safe for everyone involved. So here are the conditions under which a provider may decline to follow an MHAD. First is if following the directive would violate accepted standards of care, meaning it would go against what is professionally recognized as safe and effective treatment. Then the provider is not obligated to comply. If the requested treatment would violate the law, the provider must refrain. No directive can override legal statutes. If the treatment specified in the MHAD simply is not available, whether due to facility limitations, staffing, or resources, the provider cannot be expected to deliver it. Lastly, in the case of emergency, if following the MHAD would endanger the life or health of the individual or others, the provider has the authority to act outside the directive to protect safety. It's important to note that Washington law makes it clear that Washington legislature intends that a failure to follow these guidelines can be grounds for a civil claim and for disciplinary action in regard to the provider's license. So while MHADs are a powerful tool for self-advocacy and planning, it's important to understand that they operate within a framework of clinical judgment, legal compliance, and real-world feasibility. Ultimately, the goal is to balance respect for the individuals, their autonomy, and the responsibility to provide safe, lawful, and effective care. If a crisis results in a hospitalization under the Involuntary Treatment Act, it's important to understand what happens if a crisis escalates to that point. In these situations, the individual's MHAD may not be followed. This is because the legal framework of the Involuntary Treatment Act can override the preferences laid out in the MHAD. Specifically, if a provider determines the preferences in the MHAD are inconsistent with the purpose of the commitment or with any related court orders, the MHAD is considered invalid for that period of treatment. That means the provider is not legally bound to follow it. However, even when the MHAD is deemed to be invalid, it still holds value. Providers can use it to advise treatment decisions, offering insight into the individual's preferences and history and what has worked for them in the past. Ideally, the MHAD should be used before a crisis reaches this level of involuntary hospitalization. When implemented early, the MHAD can help de-escalate a situation and guide care in a way that aligns with the person's wishes, potentially preventing the need for Involuntary Treatment Act intervention altogether. It's also important to note that an MHAD does not give an agent the power to admit a person into a hospital over that person's objection, unless it is consented to in the MHAD. Only a judge or certain laws can decide when someone has to be admitted against their will. The agent can help speak on the person's behalf, but they cannot make that kind of legal decision alone. In Washington state, however, a person can give the agent the power to admit them to a psychiatric hospital when they lack capacity, even if they're refusing in the moment. And to do this, the person has to have had an evaluation and meet the medical necessity requirements for an admission to be admitted into the hospital. So while MHADs are powerful and important, they don't guarantee that every single request can be followed. They guide care, protect a person's voice, and help avoid unnecessary harm, but this occurs within legal and medical boundaries. Now let's talk about the role of the agent. An agent is somebody who the person chooses to be involved in their care and or to make decisions for them. The agent is like a trusted spokesperson. They help make sure the person's voice is still heard, even when the person cannot speak for themselves. The agent does not make decisions based on what they think is best. Their job is to follow the instructions and honor the preferences the person wrote down in their mental health advance directive. The agent can only make decisions for a person if the person has been determined to lack capacity by the professional. Once the person regains capacity, they are in charge of their decisions again. Choosing an agent is optional. A person is not required to name an agent in their MHAD. If someone does not want to choose an agent, they can still write care instructions that providers are supposed to follow during a crisis. However, some people feel more comfortable knowing that someone they trust is able to step in and help speak for them. If a person wants to name an agent, it should be somebody they trust deeply, someone who understands their values, will support their choices, and is willing to advocate for them when things get hard. For example, a good agent might be a close friend, a family member, a partner, or even a peer support worker. Someone who knows that person's history and truly wants what's best for them based on the person's own wishes. The agent must be willing and able to follow the directions in the MHAD. That includes what treatments the person does or does not want, who they want involved in their care, what helps them in a crisis, and any other instructions they've written. Where there's a question about what's written in the MHAD or where a decision isn't covered specifically in the MHAD, the agent should do what they think the person would want. To officially name an agent, the person must include them in the power of attorney for mental health care form, which is usually included at the end of the MHAD form. When someone chooses to appoint an agent in their MHAD, there are a few important steps to follow. First, the agent must be notified in writing that they've been selected. This is a legal requirement that ensures the agent is aware of their role and responsibilities. But even before that written notice goes out, it's best practice to have a conversation with the person. Make sure they understand what it means to be an agent, that they're comfortable with the responsibility, and that they consent to take on that role. This helps avoid confusion or reluctance later on. Now, if an agent decides they no longer want to serve in that role, they must also provide written notice to the person who appointed them and also to any known providers. This ensures that everyone involved in the person's care is aware of the change and can adjust accordingly. So clear communication and documentation are key, both when appointing an agent and if that agent steps down. The main job of the agent is to follow the person's MHAD. That means reading through the plan carefully and doing everything they can to make sure the person's wishes are respected. The agent should not guess or make decisions based on their own opinions. Instead, they should take the time to understand the person's preferences. That might include things like which medications they want or don't want, what helps them feel safe, or who they trust to support them. If those preferences are written in the MHAD, the agent is expected to follow them. But what happens if a situation comes up that is not covered in the MHAD? That can happen and it's okay. In that case, the agent is allowed to help make decisions based on what they know about the person and what they think the person would want. These might be decisions like choosing a treatment center or a hospital, deciding what medications are okay or not okay, helping change doctors or therapists if needed, figuring out which types of treatment the person would be open to trying. Even if these decisions are not written in the MHAD, the agent should still be guided by the person's values, past choices, and the things they've shared before. When these are unknown, the agent has a duty to act in the person's best interest. Now let's talk about how someone can choose the right person to be their agent. This is an important decision because this person will be speaking up for them during some of their hardest moments, like a mental health crisis. Most importantly, the agent should be somebody the person really trusts to represent their values and preferences. Next, a good agent should also be easy to contact in an emergency. That means choosing someone who will pick up the phone, reply quickly, and take action when something's going wrong. It's helpful if they live nearby and can be reached quickly if needed. The agent should also be someone who can be trusted to make good decisions, thoughtful decisions, especially when things are stressful or confusing. This does not mean they have to be perfect or have all of the answers, but they need to be able to stay calm and focused on what's best for the person they're helping. It's also helpful if the agent knows about the person's mental health conditions or is willing to learn. They should understand what kinds of things help the person feel better and what can make things worse. Finally, a good agent should care about making sure the person gets the kind of care that they want in a place where they feel safe with people they trust. This could mean speaking up for them to avoid a hospital where they've had bad experiences or asking for a specific kind of support that works well for them. Now let's talk about what it takes to build a strong foundation and how to best understand the individual's wishes. An agent plays a vital role in ensuring the person's wishes are respected during times where they may not be able to advocate for themselves. And to fulfill this role responsibly, the agent must be well prepared and informed. First, the agent should review the MHAD in full with the person who created it. This conversation helps clarify the individual's preferences and the reasoning behind their choices. It's also essential for the agent to have access to a copy of the MHAD along with the power of attorney form that officially names them as the agent. These documents provide both the authority and the guidance needed to act on the person's behalf. If any part of the MHAD is unclear, the agent should ask questions. Clarity now prevents confusion later. The agent should also be ready to help update the MHAD if the person's health status, preferences, or circumstances change. Keeping the directive current ensures it remains relevant and useful. Finally, understanding the person's mental and physical health history, including any past crises, enables the agent to make informed decisions that align with the individual's values and experiences. In short, effective support means being proactive, informed, and ready to speak up when it matters most. A mental health agent must stand up for the person's wishes when the person can't do it themselves. This is about making sure the person stays in control, even if they can't speak or think clearly in the moment. The first job of the agent is to follow the person's MHAD and make decisions that match the person's preferences and values. That means asking, what would they want? Not, what do I think is best? For example, if the person strongly values staying in their community instead of going to a hospital, the agent should try to support that choice if it's safe. If the person said music helps them feel calm, the agent should make sure others know that too. The agent is also expected to respect the person's rights and independence. The agent's job is to protect their dignity and help them have as much control over their care as possible, even if the person can't speak for themselves right then. Their voice still matters. Finally, the agent should work closely with the care team, including doctors, nurses, therapists, and any other people providing support. The agent helps explain the person's wishes and makes sure that those preferences are not forgotten or ignored. This helps the care team understand the person as a whole, not just as a patient, but somebody with a history, a voice, and a plan. In the end, the agent's role is all about honoring the person's decisions. They are a bridge between the person and the care team, helping to make sure that the person's voice is heard, their plan is followed, and their rights are respected. When someone legally appoints an agent in their MHAD, that agent is legally recognized as the person's personal representative under HIPAA. This designation gives the agent the authority to access the person's medical records and communicate directly with healthcare providers. It's a powerful role that supports informed decision-making and coordinated care. However, the agent's power is only activated once the conditions outlined in the MHAD are met. That could be a specific event like a crisis or a determination of incapacity. It's whatever is specified in the directive. Until that activation occurs, the agent does not have access to records or decision-making authority. So it's important to understand both the scope of the agent's role and the timing of which that role becomes active. Now let's talk about how agents can work with healthcare providers and systems. When a mental health crisis happens, things can move very quickly and feel very overwhelming for everyone involved. That's why the mental health agent plays such an important role during these moments. The agent is an active helper. A calm, informed agent can step in and reduce confusion, help explain what's going on, and work with the care team to make sure that the person gets the right care based on their MHAD. This can make a big difference in helping the situation feel safer and more under control. To help make sure this is possible, the person who created the MHAD should try to keep a copy of it with them, if they can. That way, if a crisis happens, people nearby, like friends, family, or emergency responders, can find the MHAD and know who to call. The MHAD should clearly list the agent's name and contact information so the care team can reach out quickly. Once a crisis starts, the agent should be contacted right away. The sooner they are involved, the sooner they can help make sure that the person's wishes are followed. If the agent can, it's best for them to show up in person to talk with the care team. But if that's not possible, a phone call or video call can still make a big impact. Just hearing a trusted voice and knowing someone is advocating for a person can help bring comfort in a time of crisis. When someone is going through a mental health crisis or receiving care in a hospital or other setting, the mental health agent plays an important role in helping make sure the person's wishes are known and followed. The agent may work with all kinds of professionals like crisis response teams, nurses, doctors, therapists, or social workers. No matter who the provider is, the steps below can help agents speak up in a calm and helpful way and support the use of the MHAD. First, it's important to do introductions and explain the role. The agent should start by introducing themselves to the provider or team and clearly state that they are the person's mental health agent. If needed, show paperwork to back this up. So they might say, "Hi, I'm Rachel. I'm the person's mental health agent, which means I was chosen to help them speak up when they can't do it themselves." Or they might say they completed a mental health advance directive and I'm listed in it as the person to help guide their care. Next, they explain what a mental health agent does. Not all providers are familiar with what a mental health agent is. It's helpful to offer a simple explanation of the role, like, "My role is to speak on behalf of the person and make sure their wishes, written in the MHAD, are understood and respected." Next, you want to share the MHAD and walk through it if needed. You can give the provider a copy of the MHAD, either printed or digital. If they have questions or aren't sure how to use it, offer to explain. You might say, "Here's a copy of the MHAD. It includes their treatment preferences, helpful strategies, and who they trust to be involved in their care." Or, "I can point out some key parts if that's helpful, especially what they wrote about medication, calming approaches, or hospital stays." Next, if the provider doesn't understand the MHAD, educate them gently. Some providers may not have had training on MHADs, and a respectful explanation can go a really long way. So you might say, "Just so you know, the MHAD is a legal document in the state. It means it guides care according to their rights and preferences." If the plan is not being followed, stay calm and keep supporting the person. If the provider is not following the MHAD, don't panic. Stay calm and keep showing up with the person and for the person, and gently keep trying to redirect the team back to the plan. You can say, I understand things are moving fast, but I'd really like us to stick with what's in the MHAD. It was made to help guide care in situations just like this. Also, be sure to reassure the person in care. Make sure to say something like, I am here and I'm going to keep helping to make sure that your plan is followed. Once contacted, the agent should be intentional work together with providers as partners. This means treating doctors, nurses, and therapists and other helpers with respect and clear communication. One of the best things an agent can do is connect with providers early before a crisis happens, if possible. Talking ahead of time helps everyone understand the person's preferences, the agent's role, and makes it more likely that the MHAD will be followed right away. Sometimes there's no chance to meet ahead of time. If that's the case, the agent should do their best to connect with providers as soon as possible when a crisis starts. The sooner the provider team knows there's an MHAD in place and that someone is legally named to speak up for the person, the better. Agents should also make sure providers have a copy of the signed power of attorney or mental health form, releases of information, and a copy of the MHAD, either by giving them a printed version, sharing it electronically, or letting them know where to find it in the person's medical record. Remember, the goal is not to take over the provider's role, it's to work together. When agents and providers communicate early and clearly, it helps ensure that the person's voice is respected and their care is centered around what matters most to them. Even though MHADs are legal documents, not all providers may recognize their importance right away. Some doctors, nurses, or hospital staff may not realize that an MHAD is more than just a personal request. It's a formal legal document that should guide care when a person's in a mental health crisis and unable to speak for themselves. If a provider doesn't seem to understand or respect the MHAD, the agent's role is to calmly and clearly speak up. For example, the agent might say, this is a mental health advance directive. It's a legal document that explains the person's treatment preferences. I'm the agent listed in the directive, and through the power of attorney form, I'm here to help and make sure that their plan is followed. Sometimes providers may not be familiar with MHADs or may need additional information. The agent can help explain what the MHAD is and why it matters. However, if the provider still doesn't understand or won't follow the directive, the agent can ask for help. One option is to request a meeting with the hospital's ombudsman or patient advocate. These are staff members whose job it is to support patients and families and help resolve concerns. They can help communicate the importance of MHADs to the care team. The agent can also ask to speak with someone from the legal department, compliance office, or risk management team. For example, the agent might say, I'd like to talk to someone who handles legal or patient rights. The person I'm representing has a signed MHAD, and I want to make sure that it's reviewed and honored. MHADs are backed by law, and agents have a right to advocate for the person's wishes. If a provider doesn't understand why the MHAD matters, it's completely appropriate to involve someone who does. In the end, the agent job is to ensure the person's voice is heard. That sometimes means educating others, staying calm but firm, and involving the right people to help make sure the person's rights and choices are respected. Next, let's talk about a few ethical considerations. Again, the agent's role is to stand up for what the person wrote, even if they would have made different choices themselves. This can be challenging at times. There may be things in the MHAD that the agent does not personally agree with. For example, the person may have chosen a treatment that the agent doesn't believe in, or ask to avoid certain people that the agent thinks should be involved. But being an agent means putting the person's wishes first. If the agent feels unsure about something in the MHAD, it's okay for them to have a respectful and gentle conversation with the individual, especially if the person is not in crisis and is open to talking. For instance, the agent might say, I saw that you listed this medication that you said you had a bad reaction to. Just wondering how you're feeling about it now. Or, is there anything in your MHAD you're thinking of updating? These conversations can be useful, but the agent should always approach them with kindness and curiosity, not pressure. It is never okay for the agent to try to force the person to change their MHAD. The plan belongs to the person who created it, and it reflects their values and lived experiences. If the person decides to change their MHAD, that's their decision. Until that happens, the agent is expected to follow the current version of the document. In the end, the agent was chosen because the person trusted them to protect their voice, and that trust must be honored. Sometimes family members or other helpers might not agree with what's written in a person's MHAD. People often have differing opinions about what kind of care is best, especially during a crisis. For example, a sibling might believe that going to the hospital is always the safest choice, even if the MHAD says the person prefers to stay at home and have a support person come there instead. In moments like this, it's important to remember that the agent is the person who has been legally chosen to speak up for the person if they are too unwell to speak up for themselves. The agent's job is not to convince others to agree, but to make sure the person's wishes, written clearly in their MHAD, are respected. Their role is to follow the person's plan, not their own opinions or the opinions of others. If others do not agree with the MHAD, the agent should try to stay calm and respectful. They might say, "I hear that you have concerns, but I need to follow the choices that they made in their MHAD. They chose me to speak for them. I'm following what they wrote down, not deciding on my own." Sometimes helpers like nurses, doctors, or crisis workers might not follow parts of the MHAD if they believe that doing so would be unsafe or cause serious harm. For example, if the MHAD says no medication, but the person is in danger, the doctor may choose to give the person medicine to keep them safe. In those cases, the agent can ask for more information or say something like, "Can you help me understand why you feel like you can't follow the MHAD? Is there a safer way that we can honor the plan while still giving care?" Again, if needed, the agent can also ask for help from the hospital ombudsman, supervisor, or legal expert to make sure the MHAD is taken seriously. But they should always stay focused on what the person wants, not what others think is best. In the end, the agent's role is to stand up for the person's right, follow their plan, and keep communication respectful, even when things get difficult or if other people don't agree. Self-care for agents is very, very important. Being a mental health agent is an important role, but it can be very challenging, emotional, and stressful. Agents help support someone they care about during some of the toughest moments in their life. They might have to speak up during a crisis, talk to doctors and nurses, keep track of legal paperwork, and explain treatment preferences. They do all of this to make sure that the person's voice is heard. But doing this kind of work, especially in a crisis, can be overwhelming. That's why it's important for agents to take care of their own mental health. Agents cannot show up as calm and clear-minded helpers if they are running on empty themselves. Everyone has limits, and caring for others works best when people are also able to care for themselves. Agents might support their own well-being by doing things like talking to a support group where they can share their experiences with others who understand what it's like to help someone going through mental health challenges. They might go to their own counseling or therapy to work through stress, grief, or any heavy emotions that come with being in this role. Sometimes spending time with family or friends who help them feel grounded, supported, or not alone can help. They can also do things that help bring them joy or a sense of calm, like being in nature, reading, exercising, listening to music, cooking, or practicing a hobby they enjoy. Taking care of their own mental health helps agents stay strong and steady, especially when the person with the MHAD needs the help the most. If an MHAD feels like they cannot continue doing the job well, that's okay. Life can bring unexpected changes. Someone might get sick, they might need to care for a loved one, might feel too emotionally drained. If that happens, the agent should let the person with the MHAD know early. That way there's time to choose a new agent or find other ways to make sure that person has the support that they need. Mental health agents matter, and when they take care of their own needs, they're better able to protect the wishes, dignity, and safety of the person that they're helping. In terms of next steps, to learn more about mental health advanced directives, please explore the additional training topics listed here. Here we have crisis support lines, including the 988, Suicide and Crisis Lifeline, the Native and Strong Lifeline, and the Native Resource Hub. And on this slide, we have a list of many, many resources related to mental health advanced directives, mental health, and Washington law related to the mental health advanced directive work. If you have questions, please contact HCA and also check out the HCA Mental Health Advanced Directive webpage linked here. Thank you.